Good afternoon. I'm here today to talk to you a little more in depth than I have usually about long-term care facilities. As I've said before, long-term care facilities, congregate care facilities, those are places that around the world and across the country have been those places that have been most affected by COVID, most vulnerable to COVID. And we have tried to take aggressive steps in the Commonwealth to assure individual safety. But as you heard, we've seen an increase in long-term care. And what that has to do with is community spread. And I'll get back to that in the end. So as I've talked to you all before, we took early and aggressive steps. March 6th was when the very first case came to Kentucky. And very soon after, we issued an executive order with respect to visitation, really earlier than most states in the country. And it's that aggressive action that we think limited some of the early exposure. We relied on all sorts of other guidelines, CMS, the CDC, our own public health, as we tried to counsel and guide and establish and operationalize all these new guidelines that were coming out across the country. And as always, our partners at Norton Healthcare really stepped up early. They provided very early, they had what is their poison control call line. They provided very early additional support to us and a 24/7 call center for long-term care facilities to access and connecting them with the public health resources. Trayton Oak Towers, remember, a long time ago? They took advantage of that kind of support. That partnership allowed us to install 10 regional infection control specialists across the Commonwealth who were able to give and are able to give advice to all facilities across Kentucky. They also partnered with us when we were beginning to deploy that statewide testing for all our nursing facilities. They actually went into facilities and helped them with their testing protocols. An example of that is they helped the VA and Thompson Hood to go through some of the testing protocols and support them as they went through and learned what those protocols could be and how to implement it in their facility. We also, again, formed this cross-functional team, this long-term care task force of nationally recognized leaders that reside here in Kentucky, our universities, medical directors from facilities who helped us establish and are helping us work through guidelines that are rational for Kentucky, that are implementable, and that will support our long-term care facilities, our staffs, our residents, as we navigate through what has been an unprecedented time. I know that word gets used far too often, but gerontologists, medical ethicists, keeping us focused on what is important, and that is the safety of our seniors in these facilities. In Medicaid, we changed how we get people eligible for Medicaid in facilities. We provided this presumptive eligibility to nursing facilities. Oftentimes, to get eligible in a nursing facility, it took months. We were able to cut that down and provide nursing facilities, families, residents, a much faster path to Medicaid reimbursement. And as a matter of fact, we think we see an increase year over year for reimbursement to nursing facilities. There aren't a lot of facilities that can say that. We also deployed a plan around testing supplies, around PPE and inventory needs as they arise. Nursing facilities could apply and try to get and get additional PPE through our web EOC resources, through our resources, and what was done to provide additional PPE across the Commonwealth for our facilities. And Dr. Stack and his team did a tremendous job of getting more supplies available. For example, 807,000 masks, 279,000 face shields, 200,000 gowns, and 550,000 gloves. And these facilities can continue to request support through the web EOC. At a certain point, we had state parks designated as an area that long-term facility staff could self-isolate following a positive diagnosis. We leveraged CARES Act funding to assist facilities in the purchase of PPE, electronic devices for connecting residents and patients, and also through Medicaid, expanded telehealth so that instead of having to take people out and move folks around, there were opportunities to provide healthcare virtually. And that was a tremendous expansion. We also then used what is called our civil monetary penalty funds in the Office of the Inspector General to support facilities in a couple of ways. First, again, for that communication for families and residents, and providing iPads and those kinds of things that would help facilitate communication, because the isolation through all this has been very hard on everyone. We also supported some outdoor places and some very minor construction on outdoor places where families and residents could socially distance and with a mask have some interaction. We provided many links for behavioral and emotional health resources with special emphasis near Mother's Day and Father's Day and Grandparents' Day. We work very closely with Leading Age and the other long-term care associations, as we are on the phone with them at least weekly and often many times in a week to coordinate with them. And they have been good partners with us. We adopted a very aggressive testing approach. Twice a week in red counties per CDC guidelines. And it follows the same map that the governor just referenced as we look at red counties. So we provided very, very close to 350,000 tests to long-term care. And we think before the end of the year, we'll reach close to 800,000 tests that we will provide through CARES resources, supported by the state. We think we've already spent over 30 million in tests that have been provided with CARES funding. Now, at the end of the year, that CARES funding ends. We need more federal support to continue some of these vital programs. We also purposefully, and we think very thoughtfully, began to reopen, right? We began to reopen transportation. We began to reopen some of that congregate dining. We began to loosen some visitation policies. But I will admit, we were very careful and very incremental. And that was intentional because, again, we are trying to keep residents safe. We completed many COVID-19 required inspections at facilities. We resumed our annual facilities inspections and conducted around 800 focused infection control surveys through our Office of the Inspector General. Staffing. Lots of challenges around staffing, positive staff, finding qualified staff, finding enough staff that nursing facilities face. And we absolutely acknowledge that has been an issue across the country. Some of the things we've done to support that, we've been working on and developing what is called a personal care assistance program. It's sort of a new category of individuals who can work in very limited roles in long-term care facilities. We know we provided over 250 of those individuals so far for long-term care, and that is made sure that we allow that under our regulations, both our licensure regulations and our reimbursement regulations. We've been working with great partners, the Kentucky Community and Technical College System, to increase certified nursing assistant testing. That has been a bottleneck for CNAs to become certified to begin to go in facilities. And KCTCS helped us with that. And they're continuing to work with us to work on, beginning next year, hopefully very early next year, a virtual way for CNAs to get and go through coursework and test. This will be a tremendous improvement and hopefully a pipeline for more staff to long-term care facilities. And coming to a close, we talk about Dr. Stack and Dr. Stack's team, and this group, the Inspector General, Adam Mather, Keith Knapp, who works out of my office. These are the folks that have really put together these plans, brought the long-term care task force together, have been on numerous calls, and really working hand in glove with the providers and with the associations, but also a special shout out to this group. The hospital-acquired infection team working at DPH. These folks have done yeoman's work, heroic work in working with facilities all across the Commonwealth. We know that they have been in contact with over 354 congregate facilities across the Commonwealth. That's personal care. That is all the nursing facilities. The folks that work in assisted living. They have supported a tremendous number of folks across the Commonwealth and have helped them through very difficult times in partnering with our local health departments and our hospitals and local EMS. They have pulled these groups together to make sure that we have an effective, impactful local response. And I can't say enough about them. So we will have new holiday guidelines coming out. Thanksgiving's coming up. We know this is a very difficult time for families and residents. We do understand the isolation. I have personal experience with that. So please know that we understand. But the thing that we focus on is making sure that residents of long-term care facilities, our seniors, our parents and grandparents and great-grandparents can be as safe as possible. So we're seeing this increased community spread across the Commonwealth. That is the driving factor in a lot of these long-term care facilities. You know, we were doing really good for a long time in keeping this community spread down, in keeping red counties as few as possible. But now we're seeing that increase. The governor addressed, we're seeing an alarming increase in long-term care facilities because we're seeing an alarming increase in community spread. It's real. I've often reported to you that we've been below the median for the country in terms of case rate, in terms of deaths in facilities. We are just now passing that median. And that is because of community spread. And you know what we can do to stop that? We can wear one of these. We can wash our hands. We can observe the guidelines that the governor talked about around red counties. It makes a difference. We can protect our seniors. All we have to do is this. Governor, I turn it back to you.
Well, thank you, Secretary Friedlander. I asked Eric to go through that today, and I asked him to do it in depth, so that was my fault.